the sympathetic and parasympathetic nervous systems are both on all the time. So what we see as the result of these systems is the opposing balance, the balance between the two things, right? So if this is our at-rest area, so we have both parasympathetic and sympathetic are active, but are both at a low level. So that's going to give us, a baseline of 72, let's say. So now let's say parasympathetic stimulation increases. Well, we'll see a decrease, right? If parasympathetic stimulation is inhibited or sympathetic stimulation is activated, then we'll see an increase, right? If we do both things, if we both inhibit the parasympathetic and activate the sympathetic, then we get our biggest elevated effect. So in other words, at any given time, each system can push the measure, this is heart rate this time, but it could be blood pressure, it could be any other thing. The different systems can push it around because neither are at their sort of end point. There's always more stimulation you can do, there's always more inhibition you can do on both sides. Now, in theory, there is a kind of maximum, where the sympathetic is stimulated as much as it can be and the parasympathetic is inhibited as much as it can be. So that's what we're seeing sort of at this last part, maximizing fight or flee response. So that would be a patient undergoing significant physiologic stressors, right? Okay, so how does this system work? If we know that the different divisions cause changes in the target organs, what is the system by which that happens? Well, there's basically two main categories of reflexes. All right, so what is a reflex? A reflex is the body's immediate response to a thing, right? So something changes, the body detects that change and then responds to that change. Ultimately, that's a reflex. We have all kinds of them, right? We have protective musculoskeletal reflexes, we have respiratory reflexes, blood pressure reflexes. So reflexes are common. Remember, it's detect and then respond. You need both things to do that. Well, in the autonomic system, we have a short, fast, dumb response, and we have a longer, slower, but smarter response. So depending on what the stimulus is and what the body's intelligent response would be, we can see either of these. Okay, so let's do the quick one first. Here, our stimulus is detected by receptors. That stimulus is sent to the ganglia. Remember last time we talked about the autonomic nervous system has ganglia, little mini brains found outside the brain, right? So that stimulus hits the ganglia. The ganglia does some basic, simple information processing and creates a response. So we have the classic elements of a reflex. We have a stimulus detected and then a response, all without going into the brain, right? So this is an example of a short visceral reflex. The processing, the intelligence is happening in the ganglion. Now, this is not going to be complex decision making. This isn't going to include information from lots of different parts of the body. It's going to be short, simple, and fast, right? So that's the short reflex. Now, if the response is more complex, or the body's reaction to the stimulus needs to be more complex, then we have a longer version of the same thing. Here, our stimulus goes all the way into the central nervous system, either spinal cord or even brain, has one or more synapses, and then comes out into the ganglia and affects the peripheral effector. So short reflexes are very fast and simple. Long reflexes can be much more complex, but they're slower. Remember, every synapse is a delay. So the more synapses you have in a neural circuit, the slower that neural circuit is going to be. Thus, we have the two different types. These reflexes, these short visceral reflexes, are why we have autonomic ganglia. Because it keeps the autonomic system able to respond quickly to simple stimuli without having to involve the slow brain.